Ed Fuller. I'm the owner of Pet Menders Animal Hospital here in Boulder, Colorado. And I started getting interested in stem cell therapy about 4 years ago. There was a company out of San Diego, California, that advertised stem cells for animals, primarily horses and dogs. And I went on their website and learned a little bit about adipose-derived mesenchymal stem cells. And I was really impressed. Went through some of their CE auto tutorials, and but I never quite took that next step. Never harvested any stem cells, never utilized the service for any of my patients, although I was impressed with what they had to say. Until just recently, when MediVet America, everything became in-house. So now, when it was the original VetStem model, we had to send our adipose out to San Diego overnight, and they refined these stem cells and isolated them. Then they would mail back an injectable product, and we would have to call the client back in, and so it ended up being like a 2 or 3 day procedure. Well, with the MediVet America in-house lab, we can do all this in 1 day. So it's a really win-win situation for everyone. We can, the costs are just a little bit less, but it's tremendously more convenient. And I think the other advantage is that we don't have stem cell death loss in transport and whatnot. So this is really exciting for us, and we're really now happy to offer stem cell therapy at Pet Menders Animal Hospital. I was really excited to have the opportunity to have our first stem cell stem cell therapy patient come to Pet Menders Animal Hospital in September. And actually we had 2 patients that came. Our first one was an 12-year-old mixed breed castrated male who weighed about 72 pounds, and that dog's name was Chewy. And Chewy, just a little bit background information on Chewy. Chewy is hypothyroid, and he's been on thyroid medication for about 6 years. And also for about 6 years, he's been on NSAIDs, or non-steroidal anti-inflammatories, because of pain issues, primarily associated with arthritis. Now, Chewy's had a front right carpal pain for at least that long, probably even longer. It was a result of some sort of injury, and I don't really know what the injury was because I wasn't seeing Chewy at that time. But he had decreased range of motion in his carpus, and he would limp. And since then, he's had a TPLO procedure to correct a ruptured cruciate ligament. But and needless to say, over the years he'll develop arthritis in that joint also. So Chewy, being an older dog, we screened his blood, did some blood work on him, and he had some kind of flagged areas. And then we went one step further and did some cancer screening, and he came out okay on that. So anyway, we went ahead. He was our first stem cell therapy patient. We harvested some stem cells from his falciform fat, which is intra-abdominal fat, and right here in the clinic, we had that processed, and we isolated those stem cells and did our injection.
Chewy is about 13 years old, 12 to 13 years old. He's a rescue from a small farm up on the western slope. He has always been a very athletic dog. He's, despite what he looks like, part border collie, and has always acted it. And I guess 5 or 6 years ago he had knee surgery, and ever since then he's been slowing down. In the last about year he's really started acting truly arthritic. He has some problems with one of his wrists that he has been on carprofen for I think about 4 years now for that. And he's just been slowing down. He's getting to be a little old dog, and we don't like to see him slowing down. So he doesn't jump in the truck much anymore, and doesn't jump out at the pond anymore, which is always his favorite thing to do. So we're hoping to get some video of him jumping into the pond again in a couple of weeks. few weeks.
Okay, perfect. Any additional comments, Dr. Full?
No, we're just really anticipating just see what happens with the stem cell therapy and the PRP. We're have great hopes, but we don't know. We don't know what's going to happen. So this is our kind of our maiden voyage, if you would say. So let's go ahead and have him get up, and then we'll take him outside and just have him walk around here real quick, and then we'll go outside and see what happens when he sees the truck.
All right.
Okay.
Come on, Chief. Come on. Yeah. You gonna ham it up, or are you gonna act all tough now? Oh no, I'm gonna go for food. Didn't have breakfast this morning. Come on. Hey. Come on, buddy. Come on, let's go out front. Come on.
Okay.
You gonna try and get in the truck? Maybe. Can you get in? Gee, get in. Oh, buddy. You wanna try and get in? Yeah, he wants me to lift him in today.
See if you can just kind of coax him and see what.
Come on. Yeah, you can do it. Not so much. You go halfway, I'll help you there.
Yeah, he just doesn't want
Just
to.
not
Doesn't
really.
want to do it. And that's part of the problem. He used to do that, and
Yeah,
he doesn't
he used to do
anymore.
that. First chance he gets, especially leaving the vet's clinic.
Okay. All right.
Oh,
That's perfect.
What we're looking for is anything else.
Yeah, that's
Right.
that's honestly the biggest thing is he just doesn't have his jump anymore. Do you, Chewy?
Huh?
Okay. Now, if he does do it,
Yeah,
then we'll know that something happened.
that's right. There's
That's
been
what that's what
improvement.
we're hoping for.
Yeah.
Still keeping an eye on him there, right, Birch? There you go.
Come on. All right, no teeth coming out.
He's a celebrity at this moment.
That's right. Come on.
So we're going to have an opportunity now to look at Chewy. This is 30 days after our original stem cell injections into the joint, and in addition to that, actually we put some stem cells intravenously that flowed through Chewy's body, just looking for a place to set up housekeeping. A couple things I want you to notice is just how much perkier Chewy looks. And the first time Chewy attempted to get into the car before we did the stem cells, kind of did a little bit of a hop, and then at 30 days did that same little hop, but then turned around and got a few steps of momentum and made it all the way up into the truck. And it appears that Chewy is very proud of herself.
Well, I guess we're at almost exactly a month out from his procedure, and he has started to show significant improvement in the last couple of weeks. He hasn't been on his pain medication now in 2 weeks, which he had been on it for 3 or 4 years on a daily dose. So he's definitely feeling a little better. He's not jumping in the truck yet, but he is jumping into the pond again.
Good.
Okay. Well, let's. Okay, so he is not jumping into the truck.
Yeah, we can
Well,
always
let's
see
see.
if he's.
You brought your
trying.
truck?
Yeah, I
You
did
brought
bring
it?
the truck. Yep.
Let's see. We have what he did last time, so we have a little, see.
And he's not on any medications whatsoever, right?
Well, he's on a thyroid medication.
Oh, okay, yeah, I meant, yeah.
But nothing.
No pain
nothing
stuff
for the
or-
pain.
And he wasn't sitting before when he used
Yeah.
to sit all the time, and he
Yeah.
hasn't sat since we've been here. And that's all he could do is sit.
So you say he's been going into the pond?
Well, he's been jumping in the pond again,
Oh, okay.
which he hadn't really been doing much of. And so
Okay.
I was like, "You can jump in." Yeah.
Yeah, you thought about it. You thought about it anyway.
You're gonna give it a try? Will you give it a try?
One more time.
Come on.
Come on, let's go.
Oh! Awesome! Awesome! I like that.
That's got to make you happy.
And you're feeling proud of yourself, aren't you?
Look at him.
Co-pilot position.
He knows.
That's great.
Oh my gosh.
There we go.
Well, that's improvement. The second dog that we did here at Pet Menders Animal Hospital for our stem cell therapy was a pit bull mix named Carmen, who was a very young dog, actually only 2.5 years of age. But Carmen started showing symptoms of osteoarthritis at 1.5 years. And at that point in time, we did conservative therapy. We recommended that the owners start giving fish oils and glucosamine with MSM. And Carmen did okay with that for about a year. However, the osteoarthritis, as predicted, would progress. And so at 2.5 years of age, which was last July, we started implementing therapy, non-steroidal anti-inflammatory therapy for Carmen. Carmen's response to the NSAIDs was really good, and the owners were happy with that. It wasn't until about a month later I talked to Carmen's owners about stem cell therapy, and they were on board. So we decided let's give a young dog stem cells in the joints, in these arthritic joints, and see what happens. And so Carmen was our second patient for stem cell therapy at Pet Menders Animal Hospital. Well, one thing that I did want to say, you know, with Carmen being such a young dog, the lifelong outlook on Carmen was a lifetime of NSAIDs, which I don't think anybody is excited about. It's one thing to put an old dog on NSAIDs for a couple of years, but to put a 2.5-year-old dog on non-steroidal anti-inflammatories for the rest of his life, which could potentially be another 10 to 12 years, is not only a big expense, but it's also a drug that does have side effects, and we want to really monitor those side effects, especially their effect on the liver primarily, and that in and of itself is not an attractive thing if we have an alternative like stem cell therapy. Is a 2.5-year-old pit bull mix, and Carmen was adopted 2 years ago from the Boulder Humane Society, and everything seemed to be good. Shortly after Carmen was adopted, she had some kind of neurologic disorder. She had a couple of seizures, and that seems to have gone away. It seemed to be exercise-induced seizures, which is a little bit unusual. A year ago, or no, excuse me, in 2010 or 2011, last summer, Carmen started to limp after exercise and whatnot. And it was at that point that we diagnosed that Carmen has bilateral elbow dysplasia, and she's got both of her hips. She has bilateral hip dysplasia also. One of the things I wanted to demonstrate is just the decreased range of motion in those elbows. Carmen's all wound up and right now, and so she's not going to really display a whole lot of limping or anything because her adrenaline's running and pretty high right now. But one of the things, Carmen, can you sit? Can you sit? Sit. Good girl. Okay. So here, this is as far as I can bend those elbows right here. Normally, if I put my 2 fingers on the point of the shoulder, I can touch the carpus to my fingers, and you can see that she's about 4 to 5 fingers away. And this is bilateral, both, and that's as far as it goes. Okay, we just run into a stop. Okay, I will try and demonstrate here if she'll stay still here. Okay, just stay there. Usually she responds. Okay, when I press on that hip joint, usually she'll actually whimper. See what happens on the other side. No? not getting really much of a response from her right now. There's too many, I think, distractions and whatnot. She's a good dog, a real young dog. And one of the things that we want to try and find out is, you know, on a young dog, what kind of a response will we get from the stem cell treatment? You know, we're going to do one old dog, one young dog.
There we go.
See what we have with each. I don't expect the range of motion to get better with the stem cell therapy, just the pain associated with the osteoarthritis. We'd like to see that improve. All right.
All right.
One of the things that we want to point out on Carmen's pre-stem cell versus post-stem cell, Carmen was a little bit better behaved in the pre-stem cell filming, whereas 30 days post-stem cell, we couldn't keep Carmen still. Carmen was constantly pulling, jumping up on us, and I think just acting more like a young, energetic dog. And I think that goes to show just how much better Carmen was feeling. If you don't have sometimes a before and after, you don't really notice the difference. And a lot of people would have looked at Carmen pre-stem cell therapy and said, boy, it looks like a normal dog there. But the other thing that I wanted to make mention of post-stem cell therapy in Carmen also is Carmen was getting was on nonsteroidal anti-inflammatories prior to the stem cell therapy, and now we're not giving any at all. And so this more energetic dog is without the painkillers also. So this is Carmen, and actually before we get your impression on what's happening, I'm going to just do, we did some correction before the deal, and we're going to primarily just look at the elbows here, okay? So, you know, he's still, I'd say still 4 fingers. He still runs into a kind of a rock hard resistance here, and that's maybe a little bit less there. Well, no, it's still 4, I would say. So flexion or range of motion is just about the same. Okay. Okay. So, but what have you noticed?
What I've really noticed is just she doesn't. Before she would always hesitate before going upstairs or jumping in a car or jumping up on the bed, wherever. And now it's just one fluid motion. Okay. And that, and also I noticed she just doesn't act as in pain anymore. Like a lot of times she'd get up from a nap or whatever and just, you could see she was very uncomfortable. And now, I mean, it's...
Difficulty getting up after she was laying down, you mean? Mm-hmm. Okay, and you don't notice
It's not,
that?
I mean, you know, it depends how long she's been laying down, but I definitely notice an improvement. I mean, she seems happier, I guess. You know, she doesn't seem to take as long to get up or, you know, move. Okay. And then walks, how are walks? They're great. She's been doing really good, and obviously. But no, she's been doing great, and.
Okay, and she's not been on any pain medication other than right after the initial surgery and whatnot. Okay, all right. And I'm just going to look at her belly real quick too, because I want to just look at her incision.
Yeah, and that looks good too.
Oh yeah, perfect, beautiful, beautiful. Okay. And all right. And you can't even hardly. Her hair's grown back.
Yeah, it's almost all grown back. Fortunately, she has short hair, so.
Right, doesn't have to grow very far, but yeah, she looks good. Yeah.
And yeah, I mean, it's hard because she's a pit bull, so she's very stoic. So but I definitely could tell a difference from, you know, the couple days after, and then after like a week, she was just ready to go. Okay, so you noticed pretty quick. Mm-hmm. Okay, and do you think she's continued to improve, or what you saw at a week was as good as she got, or how I think that she's still continuing to improve, honestly. Like the other day, my boyfriend has like a bigger car, like a Chevy, and we would have to lift her into the car. Like she couldn't even jump into it at all, and now she just
You didn't bring that car, did you?
No,
Oh,
I didn't.
okay.
My boyfriend's at work. Mine's just a little Honda, so it's not as impressive.
Okay, so she never had any problems getting in your car?
She actually did before. I mean, it kind of depended. Carmen.
Well, if she had a little trouble, let's go take a look and see
fine.
what she's did. We didn't have a before for her,
Yeah.
but we can get
No,
an
that's
after
no
the
problem.
treatment.
I started to ask this. My shoe came unbuckled. Do you mind if
Oh,
you hold it?
yeah, you can buckle up and we'll kind of hold tight. Carmen, can you sit down? There you go, very good. You do have an off button, huh? Okay, sit down. Carmen, come here. Sit down, sit.
She's a handful, to say the least.
Okay. Now let's see what she does as far as getting in the car. Is there anything that she couldn't do before that she can now, or is it just she does it differently?
It's more so, I mean, there were times too where she couldn't get up on, say, the couch, like she'd put kind of her front legs up and then just not be able to get up. But now she's usually, has no problem with that either.
Okay, yeah, you said that it was more fluid and whatnot.
Oh yeah. I mean, before it was so hesitant and just kind of one paw, like, she'd just look at you like, I can't get up.
Okay.
But, yeah, I mean, everything does seem more fluid.
And she's just like 2.5 years old, right? Okay.
Yep, she'll be 3 in February.
Okay. All right, let's go on out and see the car demo. Loading up. Yeah, that's pretty easy.
Yeah, and before I was just very hesitant. She, like I said, just kind of one.
We are happy here at Pet Menders Animal Hospital to be able to offer stem cell therapy, and especially in a one-day procedure. One of the neatest things I think about the whole stem cell idea is that really the body is healing itself. We're just gathering these stem cells, concentrating them, and putting them in a site that needs repair. And the body's actually doing it. So we're not giving any drugs. It's a totally natural thing. We don't have to worry about bad reactions because it's the dog's own stem cells. We're not taking it from one dog and putting it to another. It's really a remarkable thing, and I'm really excited about the future of stem cell therapy. And this is just the beginning. It's going to go a lot further than osteoarthritis, in my opinion.